Without objection.
Thanks, President. Everyone in this chamber knows how bad the opioid crisis is. In Ohio, based on the averages, 11 people died yesterday from opioid overdose. 11 people will die today. 11 people will die tomorrow from a drug overdose. We have a long way to go to fight this, but right now we're taking an important step to get resources to communities doing innovative work and to tear down red tape regulations that prevent people from getting treatment. This week, we were passing a comprehensive package of legislation to fight addiction. Several of these are bills important to Ohio. I work with my Republican colleague from West Virginia, Senator Capito, on our bipartisan CRIB Act to support treatment centers for babies with neonatal abstinence syndrome, like Brigid's Path in Dayton, Lily's Place in Huntington that serves people across the river in Lawrence County, Ohio, and elsewhere. Brigid's Path in Ohio is one of just 2 residential treatment centers like this in the country. Again, Huntington, West Virginia, on the Ohio River, across the river from Ohio, and Dayton, Brigid's Path, the only 2 of these in the country. I'm meeting with folks from Brigid's Path tomorrow in our office to talk with them about the important work that they are doing in our state. NAS is caused by the use of opioids or other addictive substances during pregnancy. It's become a growing challenge for families and healthcare providers in states like Ohio. Recent studies show that cases of NAS have tripled over the past decade. Right now, babies are usually treated in the neonatal intensive care unit, known as NICUs, the neonatal intensive care unit, where treatment costs are 5 times the costs of treating other newborns. But given the bright lights and the relative bright lights and the relative loud noises in neonatal units, the NICU is not always the best place for newborns struggling with withdrawal. They are even more sensitive to noise and light than other premature babies that might be in a NICU. Residential pediatric recovery facilities like Brigid's Path can give these infants specialized care, as well as bringing the mothers and the families in for counseling in a setting outside the chaos of a hospital. So while they're treating the newborn baby, they also have opportunities with some wraparound services to treat the addicted mother, so that mother and child and others in the family can have a normal, healthy life. These unique venues are relatively new. The CRIB Act will allow them to bill Medicaid for the services they offer. The CRIB Act, the Brigid's Path in Dayton, Ohio, and the Huntington program, Lily's Path, their facility, they are not eligible for Medicaid because they're neither a doctor nor a hospital. So this bill will make them eligible for Medicaid, will save millions of dollars, and as more of these Brigid Paths and Lily's Places are formed around the country, saving millions and millions of Medicaid dollars instead of going to the more expensive, less effective neonatal intensive care unit, they're going to Brigid's Path, they're going to other places like that. So as I said, the CRIB Act will allow them to bill Medicaid for their services, expanding options for care for the thousands of babies who need specialized treatment. And unfortunately, Mr. President, it is thousands of babies that are born to addictive mothers. This package will also do some other things that matter. It will lift the cap on the number of beds at medication-funded treatment facilities for 5 years, something Senator Portman and I have worked on for a long time. My colleague from Ohio, and the opposite party from me has been working on opioid issues for some time. This is one of the issues that we've worked together. The bill includes Senator Portman's STOP Act that I've supported. It will work with my Interdict Act that Senator Portman and others supported, that was signed at the White House several months ago to help keep illegal fentanyl, a synthetic substance much more toxic and powerful than heroin, to keep illegal fentanyl and something called carfentanil off the streets. We know we have more work to do to fight this crisis. We need more resources to communities in Ohio. This package is an important bipartisan step forward. I hope we can get to this to the President's desk and sign into law soon. And Mr. President, one sort of editorial comment also. I was a pretty little kid when I first kind of started hearing about this, and we all know about this. In the mid-'60s, tobacco, a huge number of Americans smoked. And Congress, the U.S. Surgeon General first brought that to the public's attention, that smoking caused people's life expectancy, lifespans to be considerably shorter. All the illnesses coming out of smoking. The federal government, in one of the great success stories in public health in the last half century, the federal government working with local health officials and physicians and nurses and hospitals and cancer societies and others and the American Heart Association and others worked together, starting with warnings on cigarette packs to the point to all the things we do now, so that the rate of smoking in this country has considerably dropped from what it was in the mid-1960s. And when our country, led by the federal government in many cases, and people can say what they want about the government, but the federal government led the way on tobacco, on that public health initiative against tobacco, we can help lead the way working with local communities and addressing this terrible public health affliction, opioid addiction, and it will matter to the next many generations if we do this right. Mr. President, I yield the floor.